Hello and welcome to our talk around GP Connect. My name's Alison Taylor. I'm one of the senior program managers within the Digitising Social Care program, and I'm also a nurse. I work out there a couple of times a month in a nursing home as well. So what is GP Connect? So GP Connect basically is accessing the medical records within the GP systems, and that shares all the patient information, your residents' information with the appropriate staff at the right time to hopefully give you time better back to care. All CQC registered providers can actually access GP Connect, but there are a couple of prerequisites for this. You must have an assured digital social care record in place, and with that you also need to have met the data security and protection toolkit. So that's your prerequisites for GP Connect. The roles that we can access are a filtered view. You don't get the whole clinical record. That's why this has been produced for non-clinicians in social care, but actually anybody that cares for the person that needs the information can access this summary record. There's a few names on there of roles, but we know out in the field there's many different roles that they could be called, but they would still be allowed the same access, and we control that access called role-based access control, and many of you out there will be part of that process, working with the digital social care record suppliers to make sure the right person at the right time has got the information. The information that you get, as I said, is a summary. It's called a HTML view, which is read-only, a bit like a PDF, but it's shown in a system digitally, so it looks slightly different within your system, but it has the same information. You get to see the last 3 encounters from the GP record. That doesn't mean it's just the GP. If residents now go and see a nurse, a physio, all the multidisciplinary teams we have in practice now, you'll get to see why they've been there if they put some notes, which is really great. The active problems and items is generally called past medical history. People do refer to it as that, but in the system it's called active problems and immunisations, as it's the GP system, and that's what they wanted it to be called. We also have medications. I don't think I need to speak to a lot of people about medications, but it's the most powerful bit of information that most people want to know. It follows most residents on their journey, be it admission, discharge, transfer. Most of our residents are on polypharmacy, so having that information readily available has been really, really impactful. And a lot of our providers that now use it as what they're spoken about is medication safeties and things like that. And allergies obviously is really important. We don't want to be giving residents pills or any medications or dressings that they could be allergic to, and very much that information needs to be shared. Moving on, very, very expanded benefits overview, goes from people outcomes all the way to the system benefits, because that's why we're doing this. We need all systems to communicate about the people we care for. And on a personal level, I've been on this journey quite a while. I've wanted access to information for people for a long time, being a nurse. And all I say is the one thing that this saves me is time in phoning people. Phoning GPs, phoning pharmacies, phoning hospitals, but not just once, twice, 3 times throughout my shift. Up to an hour, 2 hours I've been on calls, unfortunately. I've even waited for 111 before because we haven't had this information. Since being able to access this, me and other colleagues do get the information within minutes. Yes, sometimes you do have a Wi-Fi issue or you have a login issue because some people forget their passwords, but generally you get this information within sort of like the hour, which is quite transformational. I've been known to take tablets to the end of the corridor so you get some decent Wi-Fi. Just practical steps like that, but the fact that it's there and you can do that, 10 years ago, I wouldn't have been able to do that. I'd have had to go on hold and hopefully don't miss that call when it gets to it, because I'm running about doing 15 different other things at the same time. So I didn't really want to read that side to you guys, because the phone call thing for me is the most powerful thing. That's why I'm doing this today, because I want it out there. I want people getting the same benefits and the same empowerment to use information to care for the people that they're looking after, and not just clinicians. We know we don't need to be qualified and registered to care for people, but we do need the right information at the right time. Moving on, still talking about benefits and testimonials, because that's the bit I love. I think the first one probably reflects the conversations I was just having about the phone call, but the one that I really find impactful for me personally going on this journey is the fact that people don't feel they're bothering other people. And we know in any job, in any position, doesn't matter what you do, but at the care level, they don't want to bother people. They want to get on with it. They want to be empowered. And for somebody to write this down, that they don't feel intimidated or get part of their day to bother somebody, none of us should feel like that. We're all caring and we're all busy. So that was probably one of the most impactful for me, because it's emotive and it makes people feel better. And we can give better care when we feel better. So that was just a summary of some of the testimonials that obviously I've had over the last couple of years. And this is just to show some amazing figures. Over the last couple of years, we've gone from 3 assured suppliers on our list to 15 now. Actually, it's 16. 16 suppliers, 17 solutions, because Access do have 2 solutions. So you can see the trajectory over time. In the last year, you can see how much the trajectory has gone up. And I'm hoping in the next year, we've got nearly 80% of digital social care records out there in provider systems. Why should we not have them all accessing this GP Connect information? So working with the providers and our digital social care record suppliers, I really hope in the next year we can get where we need to be, because nobody doesn't want it. It's just about sharing this information, getting confident around IG, and actually using the information that you've never had before. So I know it's scary, but there really isn't a hidden agenda behind it. We just have to take it on and share this information. The bit about this slide I like as well is I think it says 22,000 up there, because I haven't got my glasses on at the minute, but 22,000 new people, staff, coming to digital, building their confidence, feeling empowered. As a manager in several areas, that lifts me, lifts my team, and that's the bit that's most powerful. And we all know people know numbers. So this is around 13% of providers, but just the edge of the iceberg for how many new staff we can get on board, get them empowered, and actually getting better time back to care. And the people receiving care actually is 113,000 at the moment, so that's quite a high number. But that's individual access records, and obviously this data is very high level, and that could be somebody accessing it for a minute, could be somebody accessing it 5 minutes, it could be 2 or 3 interactions. So take them with a pinch of salt, but you know that they're there. We are achieving these numbers, which is amazing. So moving on to one of probably the most important things that people worry about, which is the IG. So the National Data Sharing Agreement, my journey started with that about 6 years ago in NHS England, working with a team trying to make it better for everybody, not just social care providers, but anybody that wants access to this information. We as providers or any care setting do consent till it's sort of like done, and people worry about it. But we have processes in place. We still follow our processes. We still do the same whatever your companies ask for, but at national level, this is the due diligence legally that you have to have in place to use systems. It's really simple and easy to use. I can say that because I helped design it. It's no more than about 20 clicks, and you don't actually have to write anything because we've done the writing for you. The legal basis is direct care, which is amazing. And there's a little ditty when you go through the process on there that says you're a social care provider and you're using it for direct care. You tick the box, move on you go. The one thing you do need to start the process is to know your ODS code. But if you don't know it, again, in this presentation online, you can click on the ODS code link there. However, we all use Google. Put it in there, you'll get the ODS code finder up. As long as you know your postcode, you'll be able to find your ODS code. And generally, care home sites start with a V number. So if you are looking at it, check it's a V number, because some providers that are bigger will have an A number as well. But to register for this and move on the interoperability journey at the moment, your ODS code is a V number, and that matches with health. So as we move through this interoperability stage with various things, it'll be really important to make sure you know that. I think I've covered most things on there without repeating, and this will be shared afterwards. So we'll move on. I think this is my last slide. So this is just to tell everybody, 15, 16 suppliers, 17 suppliers, 16 solutions, sorry. There's 12 of them here today. Rounces, for example, is a very new supplier, and they're not here today, but I did have a couple of conversations with people that were using them yesterday, which was good. But as I say, go round, see your suppliers, have conversations. Every single one of these is assured with GP Connect. There's no reason why, if you've signed the National Data Sharing Agreement, you're a CQC registered provider, and you've done the standards met with a DSPT, there is no reason why you cannot access this GP Connect. You just need to get to your suppliers, work with them, and reach out to us if there's any problems with that. And our email will be shared on the website, which I think you've all got leaflets around with your QR codes. Please use that and access the website.